Sleep apnea is a medical condition that affects 12 million Americans, and it's quite serious in that it can lead to heart damage and automobile accidents. Essentially what happens is when a person sleeps, the back of their mouth, if you look at the way airflow should occur, with most people the air flows past their palate, over their tongue, and they can get air into their lungs. With obstructive sleep apnea, what happens is the tongue and the palate droops down and creates a cork-like action that stops the flow of air. Most patients, when they come in, their spouse will be the one who tells the tale that the person is snoring a lot, and then all of a sudden they just stop breathing. They'll sputter and make a lot of noise, and then they'll kind of uncork their airway and start breathing again. The problem with this is that it can lead to problems with daytime sleepiness. People can lose their jobs, be unfocused, their mental clarity is affected. It can put a big strain on the heart because when the oxygen drops down because their airway is blocked, that puts a stress and strain on the heart that can lead to heart attacks and strokes and heart failure. Automobile accidents are much more common in people who have sleep apnea because they don't get that restorative sleep, so they're very, very fatigued, and this can lead to car accidents. It's very important, if this is occurring, to get into your doctor and get a sleep study. A sleep study is where you sleep in the lab and they can test to see if the oxygen level is dropping. They can determine how many times it's dropping, and they can set a person up with a mask. So what this mask does is it basically pushes air past that corked area. It pushes air past where the tongue and the palate are drooping down and blocking the airway. There's many different types of masks. You think, boy, wouldn't this be hard for people to wear? But really, they feel so much better when they wear the masks that they don't have any problems wearing them. There are some dental appliances that essentially attach to the teeth that help to push the jaw up forward, and that opens up the airway. There's even some surgeries that can be done that can clear out the back of the throat, or that can push the tongue forward, and this can help eliminate the sleep apnea. There is something called central sleep apnea that's more a problem with the brain starting the breathing out. This is much less common. About 1 out of 10 people with apnea have that. If you do have the symptoms of loud snoring where you stop breathing in the middle of the night, very important to get in and see your doctor to prevent some of the long-term health consequences of sleep apnea. That's a Minute for Health.